Welcome to Grief is the New Normal. I'm Dr. Heather Taylor, a licensed psychologist and grief specialist, here to help change the conversation about grief and build community and connection while we all adjust to this new normal we are living in. This podcast is for you if you are grieving or if you are supporting someone in a season of grief. I'm glad you're here. Welcome back, everyone. I am really excited for today's guest. Joining us all the way from South Carolina is Emily Guarnotta. She is a licensed psychologist and a PMHC. Emily, thank you so much for being here today.
Thanks for having me.
I'd love to just have you introduce a little bit about yourself, what got you into this field, and your area of specialization.
Absolutely. I'm a psychologist, like you mentioned, and a certified perinatal mental health provider. And that basically means that I have some additional training in working with perinatal clients. And by perinatal clients, we mean any families that are going through anything related to infertility, pregnancy loss, pregnancy, postpartum, and I like to say postpartum because postpartum never really ends. But I work with clients pretty much in that whole kind of spectrum.
Awesome. And what got you into this field?
I was working as a psychologist for a couple of years. And when I had my own first child, I was really blindsided by postpartum depression and going through that. And it took me a long time to admit that's what was actually happening, and then even longer to actually seek help. And when I went through that personal experience, I realized that if I'm feeling that way as a mental health professional, there's so many people out there that are going through this. And that led me to pivot my practice to working with perinatal clients.
Yeah, that personal experience can have such an impact on the work we do as providers. I super relate to that.
Yeah.
Yeah. In thinking about families who've experienced pregnancy loss or miscarriage, why do you think this type of grief is often so overlooked? And what can we do to better support families in these situations?
That's a great question. I think perinatal loss, which includes miscarriage and stillbirth, is overlooked. The primary reason is because it's a form of disenfranchised grief, which means that it's not really formally recognized by society. We don't have a lot of language around that type of loss. A lot of us just don't, we feel very uncomfortable talking about the loss of unborn babies. It's one of those topics that I think grief in general makes people feel very uncomfortable, but miscarriage and stillbirth even more. So when someone experiences that, they're even less likely to have people reach out and check in and support them. And then another big factor is a lot of these losses happen before people have shared their pregnancy with their support system. So sometimes the people that are closest to them in their lives that could be there to support them don't even know. And then that's a really difficult conversation to have.
Right. It doubles down on that isolation piece where it's, I want to share this pain that I'm in, but also I hadn't even shared that I was pregnant. And so that feels weird to say I was and now I'm not. And it can make those interpersonal dynamics so complicated. And again, you already feel this wave of grief and it's so internalized, and that disenfranchised piece is so important to remember too. Yeah, like how do I share this without making it even harder on myself or those that are also impacted by this?
Yeah. And sometimes people just don't feel ready to have that heavy conversation. So to have to share that you were pregnant and then you're no longer pregnant, it's a really hard conversation to have. So I know for a lot of the clients I work with, it almost feels like they'd rather not have the conversation at all. And then they cope with their grief on their own.
Yeah. Which is hard because coping with grief and isolation, like that's not the most ideal avenue for grief support. Like leaning into community and having people walk with us through that can help alleviate some of the acuity. And there's this extra pressure or sensitivity around perinatal loss because it can be so contained to the couple that's going through it directly. That's so hard.
Yeah.
Yeah.
And just another factor too that happens a lot is that when a couple's going through perinatal loss, it's very common for partners to have different reactions to the loss and to cope with that grief in different ways. So sometimes even the person closest to you is in it with you, but you're both coping very differently. And that can feel pretty isolating as a couple.
Absolutely. I do perinatal loss work as well, and I have a couple couples that have been working through infertility for a number of years, and they each kind of have their own grief process when the miscarriage happens, and they've got their own systems, but it can be hard when you've been in this fertility journey for multiple years, and so you've experienced multiple losses and they can compound, and you see those around you having pregnancies where they're able to carry full term. And that can bring a different kind of grief. What do you see within that space?
Yeah, it's really hard when it feels like everyone around you is getting pregnant and having babies and you're struggling. And then that kind of further fuels the isolation. You might not want to go to the baby shower or the family event. And then if you make a decision not to go, then you feel guilty. So it feels like a lose either way. I always tell the families that I work with that it's okay to make that decision, to listen to your intuition and your gut that's telling you, I just don't feel like this is right for me to go.
Yeah,
And that's okay. We do have to look out for ourselves and protect ourselves. And if something just doesn't feel right now, that's okay. It doesn't mean that you're never going to go to the baby shower or the family event. It just means that right now it doesn't feel right.
absolutely. Those boundaries to protect our hearts and protect our peace. It doesn't mean we love our friends any less. It doesn't mean we're not going to show up for them and they're tiny human. And right now we're maybe too vulnerable, or it's too hard to be in that space, and it gets to be okay to say no. In a similar vein, there can be really complicated emotions that come up with perinatal loss. Can you speak a little bit to that, especially when thinking about what the pregnancy maybe represented and dreams for the future and the different kinds of loss that can be connected there?
Yeah, perinatal loss, it's a very future orientated loss because you didn't get a chance to know this little person. It's a loss of all the things that you dreamed of, imagined for your life with them. And you're grieving all those future events that you're not going to have an opportunity to experience with them. So there's extreme sadness. Often there can also be a lot of guilt and shame associated with it, especially with the moms that I work with. I would say in a lot of cases, even when a woman's told that it was not her fault, there's nothing she could have done to prevent it, most of the time there's some element of feeling guilt or believing that she could have, even though her doctors are telling her that she couldn't have. And that's a really tricky one to navigate.
Absolutely. The number of times I've heard moms I've worked with say, I feel like I failed.
Mhm.
And it was a test that you couldn't have passed. It wasn't a failing. It was complications beyond our comprehension. Like, we don't know why it happened. It's a future, like you said, it's a future forecast loss, and we can't know why it happened or what led to those complications. And we want to have a why for when
Yeah.
there isn't a why.
We don't like uncertainty. And that's what I see families often struggle with, is trying to seek out that certainty or make sense of why this happened when 99% of the time you really can't understand and you just can't make sense of it. And it can lead to a lot of second guessing. If only I had gone to the hospital sooner, if only I hadn't done this or that, or we try to just seek answers. And in some cases, there's just no answers to be found.
Yeah. Just thinking the why it isn't happening for me, the why it can go for 8 weeks and I can't make it past that 8-week mark. Those staying in that ambiguity space is just really challenging. And it's a different kind of grief, right? It's almost like it impacts our ability to just be present with what's happening.
Yeah. And then there's the anger piece too, anger that this is happening in my body, anger that, like you said, why me? Life isn't fair. This isn't fair. That's an emotion that can come up for a lot of people as well.
Absolutely. We talked a little bit about this, about how partners can grieve differently within the couple. So, what are other aspects of that dynamic that you see as challenges that couples can face when they've experienced a perinatal loss? And how can families support one another within that space?
Yeah, this actually comes up more often than not, is that partners grieve differently. And every relationship, every dynamic is different. One thing I do often see amongst the heterosexual couples I work with is the male partner trying to remain very positive and trying to focus on moving forward, whereas the female partner who just went through physically experienced the pregnancy loss is feeling very misunderstood by that because she might be wanting to, she's really grieving, she's really in her pain, and she wants her partner to be there with her in her pain. And her partner feels like the most helpful thing he can do is remain positive and focus on moving forward. And no one's right, no one's wrong, right? It's not black and white in that way, but it can lead to really a feeling of being disconnected from your partner if you feel like they're not understanding or supporting you in the right way. So I think really checking in as a couple and trying to understand, like, why is this person maybe responding in this way? Is it that they're not grieving, or maybe they just, their way of dealing with pain is putting it into positive action, and then letting them know, really expressing what it is that you need from your partner, really making it clear to them, because they probably don't know or don't understand. And they think that they're doing what's best for you, but they just don't understand because they wouldn't grieve in that way themselves.
And that's why we talk about grief on the spectrum is some people have more of that internal emotional experience. Some people are more action oriented. Some people tend to just, they just want to be angry. They want to be upset. They want to rage. And the others like, I want to do action. I want to, let's go for a walk. We lean into those different aspects of that spectrum depending on where we're at and our disposition and who we are and the relationship we have with the person who passed. And so I think that's such an important reminder that grief can look so differently within a couple, for sure.
Yeah, yeah. And there's a time and place for all reactions to grief. One thing that I hear, particularly from partners who are more action oriented, positive, is that they're worried that if they sit with their partner in their pain, that they're going to prolong the pain.
Mm,
And in most cases, and totally understandable why you would think that, assume that. But in most cases, when you sit with that person, and we know this as therapists, when you're with them in the pain, it's very healing. And it actually often, of course, there are people that kind of get stuck in their grief, but often it does help people be able to move forward when you're with them in their pain and you don't push them
absolutely.
before they're really ready.
Absolutely. They just want to feel seen. And instead of my well meaning partner rushing in to try to fix or rescue, which makes us feel minimized and unseen and like we're doing something wrong, that they feel the need to fix us. It's, yeah, this sucks. I'm just like, let's just be bumps on the couch together and be sad together. Let's get some comfort food or emotional support beverages or whatever. Let's just be sad, and being in it together feels so much more normalizing and validating and less lonely than moving into that. Let's, no, it's going to be fine next time and we're going to get through this and we'll try again. And where that can feel more dismissive. Absolutely. Sometimes people will say, we'll just try again. And there can often be that societal expectation to try again or move on, or have you tried this or have you tried that? Or they throw in the old wives' tales, things like that. How do you help support clients in rejecting these narratives and more validating their experience of loss?
It's so tricky because there is so much of that. And people, again, I think people deep down want to help, and they think that they're being helpful when they're offering you advice or saying, at least you can try again and stay positive and all these things. It's really tricky when it's the people that are closest to you in your life that are saying these things. And with my clients, I often try to work on ways that they can carefully let that person know that's not helpful and let them know what is helpful. Again, it's like expressing what you need. The problem is a lot of the people in your life just don't know what you need, and they're assuming and they're pulling at straws and they're trying different things. But if you can let them know, I know that you mean when you say this, but it's actually not helping. I really just need you to sit with me, or I really just need you just to be there with me so we can talk, or I just need a listening ear, whatever it is, really being clear with that person on what it is that you do need.
Yeah, I think so often our friends or support people, they're so worried about saying the wrong thing that they do say the wrong thing.
Yes.
They pull out the colloquialisms, the Hallmark card sayings or whatever, thinking that's going to help. And it's just like you said, just tell me like, this sucks. I am here with you. We don't have to talk about it. We can talk about it, whatever you need. Like, I'm here in this with you. That's going to mean more and have a bigger impact and help us feel more seen than any Hallmark card saying that's
Yeah.
like trying to throw a Band-Aid on a raging wound. That
Yeah.
doesn't do much.
And if someone wants advice from you, they'll ask you. They'll let you know.
Absolutely.
If they're not asking, they probably don't want it.
No, or they have a whole, like, medical team they're working with that has a plan, and your essential oil is not going to help me get pregnant.
Yes.
Like,
Maybe it worked for you or
right,
your best friend's mom's cousin, that's great, but
right.
if I want advice, I'll let you know.
Absolutely, absolutely. One of the other trickier aspects with perinatal loss is navigating kind of guilt and self-blame. So, especially after we've had a miscarriage or even a stillbirth, how do you support clients in working through feelings of guilt and self-blame?
If I'm being honest, I think this is the hardest part of the work in therapy with individuals who have experienced a perinatal loss because it doesn't respond to logic. You can tell a mom all day that it wasn't her fault. Her doctor can present medical explanation as to why it wasn't her fault. But when she feels that inside, nothing you can say or do is going to change that. And I think that that part of it, it's really a journey and it really does take time. And again, it's sitting with her in that pain, recognizing those emotions, acknowledging that even though you might not agree with her feeling that she could have done something to prevent it, sitting with her and hearing her and validating that she feels that way and giving her the time and the space to talk that out. That's a piece of this that really does take a lot of time. And I've even worked with people who have had losses years and years in the past, and that still can creep back up. The voice isn't as loud over time, but it can still make its way back there.
Absolutely. The number of times I know I keep talking about this, and I'm glad you're still talking about this. Like,
Yeah.
this is the space to talk about this because they feel like and this has just been shared, is they feel like they're burning others out in talking about their grief about their perinatal loss. And that's what the therapy space is for. You are not going to burn your clinician out talking about this. This is one of those unique aspects that can make therapy such a safe space, is like you can talk through to help work your way through that grief, that loss, that pain. And it's not going to burn the therapist out. Like, we're there to hold space for
Mhm.
that. And we're not going to try to fix or rescue, because it's like you said, there's not some magic logic phrase that is going to make it make sense for them, because it's a loss that doesn't make sense. And so having space to navigate that is so important. Yeah.
Yeah, 100%. 100%.
So, what would you say are some practical, compassionate strategies you share with families to help them cope with this type of loss?
Communication with your partner and other members of your support system, like we've talked about, is really important. Letting them know what it is that you do need so they're not
Yeah.
assuming and maybe offering support in a way that just doesn't resonate for you. And I really encourage people to take time for themselves. I know I think, I don't even want to say because I might misquote the state, but I recently saw that one state did just pass legislation that allows for bereavement time following perinatal loss. So
Oh,
taking that time, and certainly some people find that going back to work sooner is helpful, and other people really need that time. So checking in with yourself and identifying what it is that you need is super important, and then giving yourself that permission to take that time. And again, like the example of, maybe being around young children right now is just not something that feels right or you feel ready for, and that's okay. We don't have to beat ourselves up for that. We don't have to tell ourselves like you should be stronger, you should be able to handle it. And even if there are other people in our lives that are saying that or insinuating, that's their opinion. And that's okay. They can have their opinion. It doesn't mean that it's right for you and that you should follow your gut and your intuition.
absolutely. And again, those well-meaning friends, just because they're saying that doesn't mean we have to put ourselves around them. Like, we can limit our exposure to certain friends or family members that are saying those unhelpful things or trying to rush us into a place that we're not ready to go yet. And like you said, it's listening to your own intuition because your grief is unique to you. And so what feels good and right for you is going to be different than what's good and right for your friend or a cousin or a sibling. It's going to look different, and that gets to be okay.
And they're probably going to have an opinion about your grief. Like humans have opinions about literally everything, and grief is no different. And just being able to remind yourself that it's okay if they don't understand or don't agree with how you're handling your grief, it doesn't mean that it's wrong. And again, follow your intuition, your gut, what feels right to you, because this is your grief journey, not theirs.
Which is, it's also your healing journey too, right?
Yes.
And yeah, figuring out what makes sense for you. Some people want to go hike a mountain. Some people want to read endless books on the couch. It's going to be different for you. So I guess for friends and family of someone experiencing pregnancy or infant loss, perinatal loss, what advice do you have for offering meaningful and sensitive support?
One thing that I hear a lot from families that have had experienced perinatal loss is that people don't talk about it or don't check in on them because they feel the support system feels uncomfortable, or they feel like if they do ask how the person's doing, they're going to make them feel worse. And 99% of the time, I hear people say, it's not, I already feel terrible. It's not going to make me feel worse. I just wish that they would check in. I wish that they would remember the milestones. I wish that they would say my baby's name. So I really encourage family and friends to not allow your own discomfort with this topic to keep you from checking in on your loved ones. Because
That's
it's
so
often worse to
important.
not say anything.
Absolutely. Oh, that's such a great reminder.
And often, and I can understand this too, just personally, like I feel uncomfortable talking to my loved ones after they've experienced grief. And sometimes I'll say to them, like, I really don't have the words right now. I don't know what to say. I just want you to know that I feel for you and I'm here. And just sometimes just acknowledging like there are no words has a way of making it feel less awkward, because the person knows, of course, there's nothing you can say that's magically going to make it better, but just acknowledging that you're thinking of them, that you're there with them, you're there for them is so important.
Absolutely. There isn't a magic phrase or a magic one that's going to fix things. And so just acknowledging, like, I don't know what to say. And I'm remembering that today would have been the 20-week ultrasound. How are you taking care of yourself today? Can I bring you a latte? Pacific Northwest out here. So everyone's like emotional support, coffees everywhere. For our people who are grieving, it's like, how can I show up for you in a meaningful way? Whether that's I send you a Starbucks card through the app and let you know that I'm thinking of you today on what would have been delivery day or 12-week ultrasound, or even a year later. Hey, I know baby would have been a year today. Do you want company? Do you want to go for a walk? What would feel supportive for you? But just acknowledging that, because again, we're thinking about it. We're aware of the loss. We carry our losses with us. It's not information that just disappears.
Yeah.
Grief never goes away. It just gets different. And so being intentional as support people, remembering those dates is important.
Yeah. And using baby's name, if baby has a name, that from what a lot of my clients have shared, that really feels very heartwarming because it's acknowledging that that was a person who is very important to me. That was my child. If your loved one does share that the baby had a name, please use that name.
And then we're not the only ones remembering them. Someone else remembers their name, and it helps lighten that weight of responsibility to remember the people that aren't with us.
Yeah.
Yeah. Rituals and memorials can play a really vital role in grieving. What are some ways that families can honor their loss in a way that feels meaningful to them?
Yeah. I find that different ways of honoring their loss works for different families. There's just so many different ways. There could be getting a tattoo, there could be naming a star in honor of your baby, there could be donating time or money to charity. There's so many countless ways. I really encourage people to think about what really resonates for them. One that particularly stood out to me that I knew that someone did was every month they would do another kind of charitable act in honor of their baby. And one time it was actually collecting a list of therapists that worked with perinatal loss and giving it to their OBGYN's office. Because when they sought a therapist, they asked their OBGYN and they didn't really have any guidance to offer them. So I loved that they did that as a way of giving back to other families.
That's brilliant. What an amazing gift in honor of their loss. So, as we start to wrap up our conversation today, what would you say are probably two or three of the biggest takeaways for listeners to remember from this conversation?
I think one of the biggest takeaways is that your grief and your healing is really a journey and that it's unique to you. And if other people have different ways of coping with their grief or think that you should be coping with your grief in a different way, they're entitled to their opinion, but that still doesn't dictate that this is your journey of healing and you get to figure out what that looks like. And then I also really want to give people that permission to set those boundaries that feel right to them, that it's okay to say no to the shower, the family event, or to let someone know that the advice that they're giving or the way that they're trying to show up for you just isn't really something that's very helpful right now. Just to speak up and be able to let people know what it is that you need.
Awesome. So, Emily, if people are interested in working with you, what's the best way for listeners to get in touch with you? And do you have any projects that you're working on?
Yeah, so I own a group therapy practice called Phoenix Health, and we offer telehealth support for all perinatal families. So we work with families that have gone through pregnancy loss. We work with birthing parents. We work with non birthing parents, partners. We try to really be inclusive and serve everybody. We are able to serve 40 states right now. So
Amazing.
if you want to learn more about us and see if we're available in your area, our website is joinphoenixhealth.com and you can find us there.
And you're on Instagram too, right?
I am, yeah.
And YouTube?
Yes,
Yes.
we're on
Awesome.
all the socials.
Okay. All right. We'll
And
make sure to
everywhere.
have all of those links in the show notes for people if they're interested in working with you. And then anything that we haven't touched on that you're hoping we would cover today.
No, this was a really great conversation. I just really appreciate the opportunity to talk about this form of loss, which I think just doesn't get enough airtime. And it's something that 1 in 4 families go through. The rates of perinatal loss are just so high. And even though so many people go through it, it's just really not talked about or acknowledged enough. So I really appreciate the space to be able to talk about this with you.
Yeah, it was my honor to get to have this conversation. And thank you so much for your time. And listeners, thank you so much for joining in today. Be sure to follow Emily on social media or reach out to Join Phoenix Health. Remember to be kind to yourselves today, and we'll see you next time. Take care. That's it for today's episode of Grief is the New Normal. If this conversation resonated with you or you think it might benefit someone else, please share it. Sharing can open doors to healing, understanding, and normalizing these griefy conversations. If you're craving deeper insights or ongoing support, consider signing up for the Grief Gap newsletter. It's packed with resources, tips, and personal stories to help you navigate your grief journey. Visit the website www.griefisthenewnormal.com to subscribe. For those who prefer a more personal touch to their healing process, check out my grief journal, Authentically Unapologetic. It's designed to help you explore your grief on your own terms with prompts and exercises that encourage reflection and growth. I'm Dr. Heather Taylor, and I look forward to our next meaningful conversation. Our soothing tunes are provided by the Datacorns. If you're interested in sharing your story, collaborating, or learning more, please email me at hello@griefisthenewnormal.com. You can also stream the episodes on YouTube for more engaging content. Until next time, keep exploring your grief with intention and support, remembering you don't have to do this alone.